consume alcohol, but most may not be aware of how much could be termed as too much. Today's discussion on drug dangers will focus on alcohol use. My name is Ngozika Mba, and you are on ETV Channel 50 watching Drug Dangers. I have in the house my resource person for today, Dr. Montfort Olisa. You're welcome to Drug Dangers again.
Thank you, the presenter.
He is a senior resident psychiatrist with the Federal Neuropsychiatric Hospital here in Enugu. And today, like I told you, we are talking about alcohol use. Doc, what should we regard as alcohol abuse or alcohol use disorder?
Okay, thank you. I want to clarify some issues first before I define what alcohol use disorder is. Now, initially, they used to separate alcohol abuse and alcohol dependence. But now, in the current classificatory system in psychiatry, they've been brought together and regarded as alcohol use disorder. It's actually an umbrella term that involves both abuse and addiction. So alcohol use disorder, you can also call it alcohol addiction. You can also call it alcohol dependence.
That alcohol is addictive.
It is very, very addictive.
Okay.
It's very addictive. So let me continue. So alcohol use disorder or alcohol dependence or alcohol addiction, is actually a chronic brain disorder. Is now regarded as a brain disorder. It's a chronic relapsing brain disorder that is associated with compulsive and repetitive use of alcohol, to the extent that it causes distress or problems to the user and people around. And this person continues to use alcohol despite the knowledge that it is harmful. So that is alcohol dependence or alcohol addiction or alcohol use disorder. Mm-hmm. So someone continues to use alcohol compulsively and repetitively despite knowledge that it is harmful to him and that is affecting other areas of his life.
All right. Well, when should we regard alcohol use as abuse? When would you say that someone abuses alcohol?
Okay, alcohol abuse means that you're using alcohol in a way that you're not supposed to use it. You're using maybe increasing quantity, or you're using it in such a way that is affecting your areas of life. But the difference between abuse and addiction is that when you've reached the addictive level, you are no longer in control of it. So, but in abuse, use alcohol in increasing quantity, but you can still have some form of control.
You can decide at certain point.
Yes, at certain point. Okay. But when you've become addicted to alcohol, you no longer have control. At that particular point in time, you already have brain changes, and it's very, very difficult.
Okay, I need you to be clear about something. Which category of people can get to the point of dependence? Because a lot of people consume alcohol. Which people become dependent eventually on alcohol?
Okay. Now, the most important determinant of who becomes addicted to alcohol is genetic factors. Okay. People have genetic tendency of progressing from abuse or non-regular use to regular use and dependent use. So it's mainly genetic factors, and it also has to do with the way the person was reared. For instance, if as a child my father was using alcohol, there is every tendency that I might.
You'll adopt the same.
Yes, as a result of imitation. Or maybe when I stay in an environment where a whole lot of people use alcohol, maybe in slums, there is also a high
chance. Is it only in slums that
not only in slums, but
where there are a cluster of people, where you know what the next person is doing. That's what you mean.
Yes, okay. Yes, you have a whole lot of people. Well, I think it's very, very common. It has been found to be very, very common in slums, actually.
Okay. Now, still on addiction, I need some things to be clearer now. When someone, how do you quantify drinking in moderation? As per someone eventually getting dependent? If someone drinks in moderation, will the person eventually get dependent on alcohol?
Okay, I think I should first of all clear the issue of drinking in moderation. Now, initially, for males, it used to be said that any quantity that is more than 21 units of alcohol in a week is unhealthy drinking. So 21 units is like on the average, regular beer, maybe 1 to 2 bottles of beer per day. So that will amount to 21 units for males. Then for females, it was 14 units. But now it has been discovered that alcohol is actually very, very dangerous. And so now the cap is 14 units for
men,
for everybody. So initially it was 21 units for men and 14 units for females, but now it's 14 units. So what it means is that you shouldn't exceed a bottle of regular beer a day. Okay. That's the meaning.
Right.
Any quantity that is above that means that
you
it's
are
dangerous.
abusing it.
Yes, you are abusing it, and you have every tendency of progressing from abuse to addiction.
Now, why is there a change now in the quantity of alcohol that is that will be interpreted as not over the board for both genders?
Okay.
Why is it so? Does it mean that the effect
is because of
gender bias?
Research findings.
It's no longer gender bias.
Research findings, because both men and women actually have similar physiologies. So, and current research has shown that that cap is actually reasonable. That anything above 14 units is not good for whether it's men or women.
So now the effect is not gender biased?
It's not really, but at times females have been known to get intoxicated more with alcohol. But when it comes to damages, like when we start talking about the health complications, organ damage, it's not really gender bias.
All right, now, aside from gender, let's talk about very young people, like teens that abuse alcohol. Why would a young person who is not up to 20 at least abuse alcohol, and are there effects are they more dangerous than can be found with adults? Okay,
now young people have been increasingly found to abuse alcohol, adolescents, and I talked about this issue of being brought up in an environment that people use alcohol, being brought up in an environment that maybe either of the parents use alcohol. So that can actually explain why somebody may start using alcohol in a young age, or maybe peer pressure influence. So if you have friends that use alcohol, maybe a child has a group of friends that use alcohol, the person may actually imitate from them, and because of peer group pressure, they try to coerce the person, and the person may not really know that. Now that brings us to the concept of genetics. A whole lot of the person's friends may be using alcohol and it's not affecting them. But when the person uses, it may affect because of genetic differences. So that's the issue. Some of them may just, because of peer group pressure, follow others, not knowing that even when others are not affected, they may actually be affected more.
That's okay. Such habits let's talk about abuse still. People who drink alcohol while on medication, can it be termed an abuse?
It is abuse. It is abuse because alcohol can actually interfere with some medications, and that would bring forth some dangerous consequences, health consequences.
Okay, so it's actually an abuse too.
It's abuse.
Take medication at the same time you're taking alcohol.
And again, it depends on the kind of medication. There are some medications, for instance, the popular flagyl that we'll talk about. If you maybe for some reason you're prescribed flagyl, maybe you have a stomach upset, you're prescribed flagyl, and you drink alcohol while using flagyl, can actually have a serious health challenge. You might start sweating, might start becoming restless, might start having poor sleep. So that means that there's an interaction between alcohol and that particular medication. Okay. So it's not
and
a
such
good thing.
Cases with several others.
Yes.
Now let's talk about the behavioral effects of alcohol. use as against abuse? Someone who uses alcohol, how would you know? Someone who abuses it, how would you know? And then someone who is dependent on it, how would you identify such persons?
Okay, so let's talk about dependence now. Dependent syndrome. How do you? Because some people use alcohol occasionally, maybe when they hang out with friends, they use it. They are not really regular users. But the major problem is when it gets to dependent level. So there are criteria for discovering or finding out who is dependent. The first of them is tolerance, something that we call tolerance. Tolerance means that if, for instance, I started with using a bottle of alcohol, with time, if I'm prone to developing addiction, with time, that bottle of alcohol is not going to be able to give me a pleasurable effect that I used to get. So I continue to increase the quantity to be able to get that pleasurable effect that I used to get before. And it continues, becomes a positive chain reaction. So that's one of the signs that you're actually getting addicted. You're transforming or transiting from regular use or normal use to abuse. You continually increase the quantity. Then again, when you stop using it, maybe you're not able to buy alcohol, you don't have money, you begin to have serious withdrawal symptoms. You have problems with sleep, you become depressed, you might be anxious, you might be tremulous. So these are some bodily symptoms. So anytime that a user of alcohol stops using alcohol and he begins to experience these symptoms, it means that he has actually progressed to dependent level. Or maybe the person starts having craving. Craving is like an uncontrollable urge to obtain the substance. And that's why some of them that use alcohol, there's something we call an eye-opener. I talked about it the other time. The first thing they do in the morning is to go and drink alcohol or to go and obtain it if it's not in the house. So that is because they have uncontrollable urge. They can't function without it. So they crave for it. So, and again, when you continue to use alcohol, to the point that it begins to affect other areas of your life, you have primacy of alcohol use, you neglect your family, you neglect your work, you neglect every other thing that used to give you pleasure, and you now concentrate on alcohol. It means that you are really progressing. And again, when you are aware of the consequences, the consequences of use of alcohol, and you continue to use it, it means that you've actually progressed from non-regular use to dependent. So these are some of the telltale signs that you actually are becoming dependent.
Okay, you just focused on dependence. We are taking a short break, and when we return, we'll talk more about the rest, like the use and the abuse. I'm sure that there is going to be some issues. There are going to be things that you will bring up to differentiate the three. Let's take that break now. Drug Dangers returns in a moment. It's Drug Dangers showing on ETV channel 50. Welcome back. I still have in the house Dr. Montfort Olisa of the Federal Neuropsychiatric Hospital, Enugu, talking about alcohol use. Before we went on that break, he was trying to talk to us about some of the symptoms of alcohol dependence. But Doc, like I told you before we went on that break, I need you to still talk to us about some of the symptoms of alcohol use. How would I notice that someone who I live in the same house with or my colleague is using alcohol? And then when would I notice that it has transcended to abuse? Okay,
first of all, abuse is also use. It's just that you're using it in an abnormal way or you're using it in an increasing quantity. So now you have categories of use. Somebody can just be an experimental user. He experiments on it. He has been told that alcohol, gives a pleasurable effect. He has been told that alcohol boosts confidence. He has been told that alcohol produces euphoria. He just uses it. He experiments on it. So that's a category of use. Then someone can also be an occasional user. He uses alcohol maybe anytime he goes out with friends, to be able to boost his confidence. So what it means is that each time he goes out with friends, he uses it. So that's a progression from experimental use, to this particular one. Then from that occasional use, somebody can also progress to regular use. Assuming the occasion that brings about occasional use is increasing. maybe you are being taken out, say once a week, and it increases to every day. So that's regular use. You're using it regularly. And from that regular use, you can now get to dependent use, where, the difference, just like I told you, difference is that the dependent user has loss of control. But every other thing before dependent, yes, you can control
things.
You can control it. Okay. So, and the abuse we talked about is that you are using it in a situation where you're not supposed to. For instance, somebody that uses alcohol before drinking. Before uses alcohol before driving. Sorry, that's dangerous use. So it's a form of abuse. Or you use it in a quantity that you're not supposed to use it. Maybe binge drinking. That's also abuse. But the difference is that someone who is dependent has no control. Okay. There is a compulsive use. He must use it, or else he wouldn't function. So that's
okay, Doc. Now I need you also to talk to us about binge drinking. Is that a psychiatric issue? Is that does it have anything to do with mental disorder?
It's still within the spectrum. Binge drinking means that you drink, a kind of increasing quantity of alcohol. Maybe you used to drink a bottle, and something now happens. Maybe somebody annoys you, or maybe somebody takes you out. Maybe you won a lottery, you drink a crate. That is binge drinking, because that's not your usual and that one would result in more intoxicating effect and damaging effect.
Okay. Now we talk about the risk factor for dependence.
Okay. So the risk factors for dependence could be genetic. In fact, we found out that people that are dependent on alcohol, if you ask questions around their families, you will see one or two people
who are
also, yes. So that is a general thing for mental disorders and behavioral disorders. When you take history from them, you find out that maybe their sibling or their father had that problem. So the thing is, they have that genetic tendency of engaging in substance addiction or alcohol addiction. Then again, the risk factor, just like I said, is being brought up in an area where people use alcohol. Or maybe you have drug using network. Most of these drugs, like alcohol, they are used in group. Like they can tell you, let's go and hang out and drink. So if you have such a network, it's a risk factor, because anytime they want to hang out, they call you. So, and if you don't join them, you become a Jew person. So these are some of the risk factors, or maybe stress. People who have problems with stress, they are not able to manage stress. They use alcohol as an escape. So these are some of the risk factors.
Yes, so alcohol to some could be an escape substance.
Yes, to temporarily forget their pains and worries. Maybe somebody loses a job, he doesn't have any comforting relationship, he doesn't have good family support, just can go into binge drinking, to forget about himself.
Now let's talk about the effects now of alcohol use, or should I talk about alcohol dependence?
Alcohol dependence.
Use because even if you're not abusing it, but then you have to abuse it for you to experience negative effects.
We'll discuss all of them.
All right. So now start with the behavioral effects of alcohol use. The
behavioral effects. Now we can classify the complications of alcohol use into neuropsychiatric complications. That's what we're talking about. And other systemic complications. So let's go to neuropsychiatric complications. That's the behavioral, it's part of the behavioral we talked about. Now, this issue of withdrawal, when somebody is withdrawing, when somebody is not using alcohol, for instance, he has been a dependent user and probably is not able to obtain it, there is lack of alcohol. Remember what alcohol does is that it increases the level of a neurotransmitter or a pleasure hormone called dopamine. It's actually that hormone that gives pleasure. So if someone was using before and stopped, there's going to be relative deficiency of that pleasure hormone. So the person begins to feel depressed.
But the pleasure hormone comes up naturally.
It comes, but alcohol boosts it. That's one thing with all these substances of abuse. They triple or quadruple the level of dopamine in the central nervous system. So, and that's why they always remember that each time they take it, they have pleasure.
They're hyper.
Yes. So that's it. So if somebody stops using, there's going to be a there's going to be a drop of level of dopamine, and the person begins to feel sad. Depressed. That's depression. The person begins to feel anxious. Some of them may start having sleep problems, sleep difficulties. They become agitated. At times they may even become aggressive. So these are some of the behavioral complications. Then again,
when you stop, when you try to stop,
when you stop, then when you are using, you can get intoxicated.
Mm-hmm.
You might engage in dangerous driving, and some of them may also become aggressive.
Violent.
Yes, violence. They come back to their house, they start beating up their wives, and they start having marital issues. So these are some of the behavioral problems. Then there's something we call alcoholic hallucinosis. This is a situation whereby somebody it happens in people that have used alcohol for a long period of time. They begin to hear voices, often strange voices, just like we are discussing. Two of us are just discussing. You begin to hear strange voices and you're not seeing those people. And they become afraid. At times they become delusional. They believe that people are against because of those strange experiences that they're having. And at times they begin to, for instance, if you start hearing voices of people that you're not seeing, you become agitated. You begin to suspect people around you. Mm-hmm. Some of them become violent as a result of that. So these are some of the behavioral complications. Now, the neurological complications of alcohol can be many. Now, alcohol affects several areas of the brain. Let's start with, there's an area of the brain called hippocampus. The function of hippocampus is to facilitate memory storage and retrieval of information. Just like you go for a lecture and the lecturer is teaching, you are assimilating, you're understanding it. But that thing you understand, it has to be converted to long-term memory so that when you go for an exam, you'll be able to remember it. So alcohol interferes with that process of conversion of short-term memory to long-term memory and also retrieval. So they begin to have memory problems, memory losses. Then again, alcohol also affects an area of the brain called prefrontal cortex. And the function of this prefrontal cortex is to modulate behavior, judgments, for you to be able to judge that what you're doing is right or what you're doing is wrong. And that is why they continue to use alcohol despite the damaging effects, because that area that is responsible for regulation of judgment and control of emotion is not functional again. Alcohol has damaged it. And some of them also stagger. There's something we call ataxia. People that drink alcohol, they stagger, whether acutely or chronically, they stagger a lot. And that is because an area of the brain responsible for coordination of movement has been damaged. They begin to stagger. Then alcohol can also affect an area of the brain that is responsible for control of heartbeats and breathing. And that's why when people drink to stupor, they begin to vomit, they begin to have slowed heart rates. In fact, some of them even die from it. Because alcohol is a depressant. It suppresses several areas of the brain. So these are some of the problems, that neurological complications of alcohol use. Then when you come to the body, alcohol is an irritant. Remember, this methylated spirit that we use, it contains up to 98% of alcohol. And you can imagine I don't know whether you've ever been managed, maybe you had a wound and they use methyl. You see how painful it is. So alcohol is an irritant. So as you're drinking alcohol, it is irritating the internal lining of the digestive tract, and that's why some of them have ulcers. That's one of the complications or worsening of ulcers.
Your point is that the same effect that methylated spirits have on a wound is the same effect alcohol have in some
depending on the concentration.
Okay.
Like the regular beer is about 5% alcohol by volume, while the spirit is like 50% or 40%. But methylated spirit is like 98%. Okay. So it will not be that toxic, but it's still toxic. So it damages the internal lining of the digestive tract. And when the body now wants to heal, it may overheal, and that's why they have cancers of the digestive tract. Then alcohol also damages the liver, because liver is an organ that degrades all the toxic waste in the body, all drugs and toxins. So it damages the liver, and when the liver is damaged, the liver is no longer able to excrete or remove toxic waste. So those toxic waste will now get access to the brain and still damages the brain too. So alcohol has several effects, even immunity. It reduces the immune functions.
And then the person gets sick at random.
Yes, and one of the tests that we run for them is chest X-ray. We check whether they have TB, because most of us actually have TB, but it's quiescent.
Wow.
Yes,
that's scary.
Yes, most of us have TB, but it is controlled by the immune system. It is warded off and prevented from spreading to other parts of the lungs and other parts of the body.
And when you take alcohol,
it depresses
the immunity.
Yes, it depresses that immune coverage, and tuberculosis bacilli will now begin to spread to other parts of the lungs, and they begin. So, in fact, most of them that we screen, we actually find out that they have TB as a complication of depressed immunity caused by
alcohol use. Okay, Doc, at this point I have to cut you. But then before I let you go, you said something, you run tests for them. That is to say that there is help available for people who abuse alcohol as well.
Yes, there is help.
All right, and that can also be obtained from the Federal Neuropsychiatric Hospital.
We treat them and we run tests to rule out complications.
And then you cancel them as well.
We cancel them.
All right, thank you very much. You've been most helpful today. Remember, we discussed alcohol use on Drug Dangers, showing on ETV Channel 50. My name is Ngozika Mba, and I was with Dr. Montfort Olisa. He is a senior resident psychiatrist with the Federal Neuropsychiatric Hospital, Enugu. And on behalf of my producer and the entire production crew, stay out of drugs.